Good morning, everyone. This is Rick Morgan and Chandler, Aragona. We are waiting for folks to get signed on. We will begin in just a minute or two. Good morning, everyone. This is Rick Morgan. I'm one of the partners in our Columbia, South Carolina office. With me today is one of our rising stars out of our Charleston, South Carolina office, Chandler, Aragona. We will be presenting on the topic of a COVID-19 policy and whether or not your policy is OSHA compliant. What we'd like to be able to do today is to, one, I'll call it set the table a little bit as to why we believe a COVID policy is important, and whether or not you have a policy in place. We want to talk a little bit about where the policy is derived from, and that's the general duty clause. We want to give a little summary of that, talk about some recent guidance on the COVID-19 plans, and then go through the basic elements of what a compliant OSHA COVID-19 policy would look like. We certainly will be looking for any questions that you have as we go through. Let me start a little bit with trying to set the table. On January 21, when the president went into office, he issued one of his executive orders, and he directed OSHA to develop and implement a national emphasis program for COVID-19. By March 12th of this year, there was some guidance issued on a national emphasis program for high hazard industries or work tasks that OSHA believed ought to be protected from exposures to the COVID-19 virus. We fast forward then to June of this year, and we saw the emergency temporary standard in the healthcare space that was passed, outlining some of the things that OSHA believed important for the healthcare arena. Then in July, really pretty closely on the heels of the healthcare ETS, an updated national emphasis directive was issued, and it covered, embedded in it, not only on the healthcare side, but on all other employers that were covered under OSHA. That's a pretty broad sweep, as we all know. Then we get to August of this year, and we see some guidance, not a standard, but some guidance issued on what should be included in a compliant COVID-19 prevention program. And that's what we want to spend some time on today, is discussing that. As we look at background, though, I think it's important to understand, where does the authority come from for the executive order and for OSHA to issue these guidelines, guidance, emergency temporary standards? What we're seeing a lot of is it's really, it springs out of, if you will, the OSHA General Duty Clause. For all of you on the call here today, are aware that the OSHA General Duty Clause requires every employer to furnish to each of its employees a place of employment that's free from a recognized hazard. And that's one of the things that you have to focus in on, as definitional terms: a recognized hazard that's causing or likely to cause, one, death or serious physical harm to its employees. And I think those three terms of recognized hazards, death or serious physical harm, are important for all of us to keep in mind as we go through the discussion today. All of us, I think, are aware that all of our employers have to comply with all safety and health standards that are under the OSHA Act. And I think most everyone on this call certainly tries their best to comply with all of these standards. When we look at, I want to break down for a second a General Duty Clause violation. I focused in on a couple of things when I went through the statutory language itself. What an enforcement would look like is a couple of 3 or 4 points. If you have a General Duty Clause violation, what OSHA will look at and determine is that you failed to keep the workplace free of a hazard to which employees of your company were exposed. Critically, an element would be that the hazard was recognized. Critically, that the hazard was causing or likely to cause death or serious physical harm. And this is one of those conjunctives that we have to deal with in statutory interpretation, was there a feasible and useful method to correct the hazard? And that gets into all of the discussion of what we're doing with masking and social distancing and contact tracing, and the very, I think, divisive issue of the vaccine mandates that is pending over at OMB. So that's a general background of the General Duty Clause requirement, where a lot of the basis for the guidance that was issued springs from. In that August 13 guidance that OSHA issued, one, we need to remember that it is not a standard, it is only guidance. But when you drill down into the language of that August 13 guidance, that General Duty Clause is mentioned over and over and over again. And it's our view that the number of times that the General Duty Clause is mentioned makes it sufficient to indicate that employers should have knowledge that they consider COVID-19 a hazard likely to cause death or serious illness. I think we look, I know I look every day at the statistics here in South Carolina, the number of new cases, probable cases, the number of deaths. And in all of our states, we've seen any number of our friends, colleagues, people that we don't know who have had the COVID. You hate to think in terms of a death count, but every single day here in South Carolina, we have a death count. So we know it's real. We know it's happened, and it is happening as we speak. So that is a couple of things. We've already gone through a number of points, but if you go back into some of that March guidance that I mentioned as we went through the history, embedded in the language of the March guidance that was issued as part of the early National Emphasis Program, they have language in there where it urged employers to have a written COVID-19 plan. And that plan needs to have a number of components that we're going to go ahead and discuss with you here in a few minutes. So this is an issue really that has been with us at a minimum since the issuance of the president's executive order in January. We've seen some additional guidance through internal directives that OSHA has issued over time. And that August 13th guidance clearly gets us to the point where we are today, and really to the topic of discussion of what would a good prevention program look like based upon all of the language that we have to deal with under the guidance that's been issued since January. What we're going to do is we're going to go break it down by component parts. I'm going to turn it over to Chandler and let her start with some of the critical components dealing with authority and responsibility. Chandler?
Sure, thank you. So I just want to start by saying, we've been hearing a lot of these buzzwords over and over and over since March of 2020. So some of this might seem a little bit repetitive, or it might seem like things that are common sense by now, but just based on OSHA's August 13 guidance, these are things that they want to see in the written policy. In the unfortunate event that you do have an outbreak or a death in the workplace, you want to have these things in writing, and you can point to it to say, here's what we did, and here's how we did our best to prevent this from happening. So first and foremost, you want your policy to set out who is responsible for what. You want to make sure that it's clear that all of the managers and supervisors are responsible for implementing and maintaining the COVID policy, and it's the employee's responsibility to follow that policy. Next, you also probably want to have almost like a log type of sheet where you identify all of the potential hazards in your workplace as they pertain to COVID. So are there rooms in your workplace which employees cannot social distance? Are there areas of the workplace where there is very heavy customer traffic and customer interaction? Are there areas where you have your employees potentially coming in contact with positive COVID-19 cases? You want to have those hazards laid out, most likely in a spreadsheet, and you want to identify each and every one of those. Another thing that you probably want to have in that spreadsheet is what you're doing to mitigate that hazard. Are you placing the fiberglass sheets in between your employees and the customers in areas which it's difficult for employees to social distance? Do you have stickers on the floor that show here's where you should be standing to stay 6 feet apart from one another? You just want to have that spreadsheet to show here's a hazard and here's what we're doing to prevent any additional hazards. The next part of what your policy should contain, again, a lot of these topics have been discussed over and over and over since early 2020, but it's important to put them in, put it in writing. What is the employer going to do with respect to these topics? Face coverings. Is the employer going to provide face coverings to its employees? Engineering controls such as ventilation, and a lot of this will be specific to the industry, location, operation, things like that. But are there areas where you have, low ventilation? What are you going to do to comply with the industry standards to keep the employees safe, in terms of COVID? Cleaning and disinfecting the workplace. It seems very self-explanatory, but what are you going to do to maintain a clean workplace? Are you going to have a cleaning crew come in every single night and sanitize? Are your employees going to be responsible for maintaining a clean workplace? What type of products will you provide for the cleaning? All of these things are things that OSHA wants to see in writing in your policy. PPE. This is also going to be specific to industry and location, but are you going to provide your employees with gloves, goggles, respirators, or face shields? You just want to have that addressed in your COVID policy. Another thing they might want to see is what type of testing are you going to be offering your employees, if any? Are you offering on-site testing for potential COVID cases? Where is that testing going to be held? What preventative measures are you going to put in place for if that testing is held on site? Rick, do you want to pick up where I left off? I think you're muted.
I am technologically challenged as we look at all of these things. The next thing I think we need to look at is once you get past some of these I think fairly routine things that each of us have been doing in our workplaces, what are we doing when we get to a situation where we have a COVID incident or COVID outbreak in our facility? What are the steps that we have in place? Again, a lot of these things are items that each and every one of you have looked at. I'll give you an example. When we're working with a client right now who, when we get to investigating and responding to COVID-19 cases, which is going to be a required element, if you will, of a policy and what OSHA will be looking for. This employer has a multi-layered approach on how it is going about, and I think it's really a good template for moving forward. They are going back and gathering all of the directives, advice memos to employees, and putting it in one place and capturing it in their COVID prevention program or COVID policy. They're layering their approach when we get to the investigation and response through standard operating instructions. And then on daily updates, they're issuing communication pieces to employees through their intranet and also through other written forms to ensure that employees are knowing what they're doing. So there's a transparency there with communication. But what are they having placed now into those three policies? The first thing that they've tried to do is define, and they're following CDC and OSHA guidelines very carefully, employees who have had that close contact issue with someone or someone who's tested positive. One of the things that this company is doing to investigate and respond is they're trying to stay ahead of the game by offering testing at no cost during working hours. They're going through ongoing training as part of their overall safety program embedded in their standard operating procedures about what COVID is, what COVID isn't. They're trying very, very hard to keep to the science of the issue, understanding that there's tremendous emotion on all sides of this issue when we address COVID in the workplace. They are, as part of that training program with them, employees, making sure that they get noticed. They have a very quick turnaround once they are informed of a positive COVID case, so that they can begin to follow through with all of the contact tracing and the quarantining that would be appropriate to protect not only that individual employee, but also other employees or contractors that may be working within the facility. What does that communication system look like? So when you're investigating and responding to COVID-19 cases, you want to have a thoughtful communication system. How are you going to do it? Remembering that you certainly want to try to protect the privacy of someone who has a medical condition, but you need to be thinking about how within the culture of your organization, you communicate when you have an issue where there's been a COVID-19 incident. It's a two-way street. All of your team members, employees, have to also have a comfort level that they can report these things in a way that the company will be responsive and sensitive to how they get that information. And as with so much of what we do in the employment arena, employees have to understand that they're going to have the ability to report on up to you without any fear of reprisal. We see and I think many of you see when we all read the statistics that retaliation claims across the board in all of the employment arenas are on the rise. And so as we look at how we deal with this COVID issue, we want to make sure that the employees feel comfortable in reporting that on up, and that they're not going to be punished in some way for informing you of the fact that they've been exposed, they've tested positive, and the like. I've already mentioned that you want to make sure that you have relationships either internally or externally where you can get COVID testing done really as promptly as possible. And when that COVID-19 you're informed of a COVID-19 exposure, you want to make sure, as Chandler pointed out just a few minutes ago, that you have a response set up within your programs and policies for cleaning, extra cleaning. Are you going to use the atomizers? If someone's going to do the cleaning internally, that they have all of the proper PPE, whether it's gloves or masks and the like. Are you going to do the deep clean through yourself, or are you going to have a contractor come in and do that. And you need to let your employees know that you have those things in place so that you can, I call it, quell the fear with regard to place just isn't good for for me. Training, I mentioned this. You need to have in place not only training for your what I'll call hourly workers, but your supervisors need to know what their responsibilities are as we try to protect all of our employees from these COVID-19 exposures. You need to let them know, again, as part of that training program, based upon the science, that it is an infectious disease, how it's transmitted, and the things that you have in place to address those things. And we've seen any number of emphasis points that employers have tried to ensure that folks are vaccinated. And that's one of the issues that will be highlighted once OSHA comes out with its new emergency temporary standard, which will be, I think, a topic for another morning show as we move forward in the future about what it is and what it isn't and how we need to comply. But what are you doing with the vaccinations right now? As part of your training, are you informing employees, proper use of PPE, proper use of mask? I know I can't tell you the number of times that we have a mask requirement here in the city of Columbia in the buildings, and I'll see people walking around in the building with the mask around their chin, and it's certainly not covering their mouth and nose, as would be a proper way to ensure that a mask is worn to avoid exposure. And we've been through all of these things with our, hand washing, sanitizing the areas where we work. But that training program, if you haven't already done that in your organization, you should be doing that. But that will be part of what OSHA will look at to see what you've done in a policy. So if you've done all of those things with your employees and train them, capture it all in one place and make it part of your policy. I think that would be something that would be very, very important as you try to develop that. So training is going to be a component part of the policies. Chandler, I think push it back over to you on exclusion and employees who had the close contact, and talk a little bit about that from a policy perspective.
Yeah, absolutely. Just for a minute, I do want to go back and touch a little bit on, investigating and training procedures. I think it's important both in terms of an OSHA standpoint and from a practical standpoint to have your investigation procedure in writing and accessible by your employees. If there is a confirmed positive case in the workplace, they need to know, who do I even report this to? Do I report this to my supervisor? Do I report this to human resources? Am I responsible for telling each and every person that I came into contact with that I have a positive COVID case? Just lay it out step by step what the employees need to do. What you don't want is for the situation to escalate and there be panic and whatnot. So I think it's important to lay that out in writing in your COVID policy, just for OSHA compliance, with respect to their most recent guidance and as a practical matter. In terms of exclusion, and employees with confirmed positive cases, the most important component of this is to be in line with the CDC. Make sure your policy is in line with the CDC. I know that can be difficult because what we're doing now may not be what we were doing, even a couple months ago. So it's important to stay up to date with the current CDC status in terms of exposure. So what the CDC is currently saying is if there is a known positive COVID case, that person has to get tested within 3 to 5 days of exposure. If you're unvaccinated, you have to quarantine until you receive your test results. If you're vaccinated, you simply have to wear a mask until you receive your test results. Excuse me. Can you all still hear me?
Yeah, you're good. And folks, if you have any questions, please go ahead and put them into the question and answer box so that we can address those things that are on your mind.
Yes, absolutely. Another key aspect to, having in your policy what to do in terms of exclusion and positive cases is what is your leave policy going to be? I'm sure we're all familiar with the SFCRA and the leave that was provided that ended in December of 2020. I know there was tax credits if you continue to abide by those provisions, but as of right now, there's no federal mandate that says that you have to provide leave with respect to positive COVID cases or taking care of others. But what you want is for your employees to have a clear understanding of what will happen if they contract COVID or if a family member contracts COVID. So make sure you list out, are they going to have the option to take their PTO, utilize sick days? Are you providing any type of paid leave for COVID? You just want to make sure that it's all laid out in your COVID policy. In terms of reporting and record keeping and access to that information, you obviously want to report COVID outbreaks to the local health department and whenever required by law. Whenever you do have a COVID-related or a workplace COVID-related case, you do have to report that in your OSHA 300 log. It's interesting that OSHA is not requiring employees who were vaccinated on site and then subsequently experienced difficulty with getting the vaccine. That is not an OSHA reportable incident. So I think that's OSHA, wanting to incentivize employees to get the vaccine. So you want to maintain the records of the steps that you have taken to implement your COVID program. I think it's also important, I'm not sure if we've discussed this yet or not, to keep a record of which employees are vaccinated and which are not. I think that might be something that OSHA wants to see in your COVID policy as well. Rick, are you getting any questions?
I just saw one question. The question is this. I'm going to go ahead and answer it. The question is this. Most employees can figure out that one of their coworkers has COVID when they are out for 14 days, but is the employer required to tell other employees exactly who has COVID? The way that I read the statute, and we go through contact tracing, certainly those who may have been exposed, you would want to have that discussion with them. But as far as a general, hey, Rick Morgan's out with COVID, everybody, no, you don't need to do that.
Right. I know that a lot of times it probably will be self-evident who has COVID, but I think all that has to be done is, inform the employee that they may have come into contact with someone who's tested positive for COVID-19, and unfortunately, sometimes that's just very obvious.
Yeah. There is another question, Chandler, and it is, we typically follow the advice of the, I guess it's healthcare community regarding quarantine, et cetera. Will this suffice? Yes, and there's different local standards I think that you have to look at. You have your CDC overlay. Here in South Carolina, we had some differences with DHEC on quarantining early on. So look at your local healthcare, look at your state agency that may have some responsibility, and CDC as well. And my thought would be, that you would do the whatever provides the most protection to keep you out of liability would be the appropriate step to take. Okay, go ahead, Chandler. I didn't mean to interrupt. There's another question that came up, and we'll address that at the end.
Okay. I think I was still talking about the reporting and record keeping access. I mean, essentially, you want to have absolutely everything documented. You know, if there was an encounter or a confirmed case, what did you do to investigate that? If, you know, as I was saying earlier, hazardous conditions in the workplace, you just want to have everything documented within your COVID policy. I don't think that we've talked about return to work criteria yet. That's another large area that you want to have included in your policy as well. I know that this changes with respect to who has been vaccinated and who has not. You just want to have that laid out for employees in accordance with CDC guidelines, how long they have to quarantine for, what, you know, contingent on their vaccination status, and when they can return to work. And that kind of coincides with, you know, your leave policy. You want to make sure that it's very clear, according to your policy, when that particular employee may return to work. And I don't think that this is still as big of an issue as it was back in 2020. But if you are going to require a negative COVID test to come back to work, you also want to have that in there as well. I don't think that people are doing that nearly as much as they were back in 2020. Are we getting a couple more questions, Rick? It's hard for me to see.
Yeah, go ahead with the return to work, and then I'm looking at the questions right now.
Sure. So right now, according to the CDC, positive COVID-19 cases, regardless of vaccination status, with symptoms, will not return to work until all of the following have occurred. At least 24 hours have passed since a fever of 100.4. Other COVID symptoms have improved, and at least 10 days have passed since the onset of the symptoms. So that's regardless of vaccination status, a positive COVID-19 case with symptoms. As for a positive COVID-19 case, tested positive but never developed symptoms, that person will not return to work until a minimum of 10 days have passed since the date of that the specimen was collected for their COVID-19 test. And as for close contacts, you will obviously want that employee, I mean, that's going to kind of coincide with what we discussed earlier, what to do whenever they're, you know, when there is a close contact. Employee is tested with negative results and may return to work upon receipt of negative results. And that's going to depend on whether or not that employee ends up showing symptoms after the close contact or not.
There have been a number of questions. The one question has been asked about the executive order for federal contractors, and is that different from OSHA? The best way that I can answer that is this. When we look at executive orders in the federal contract arena, the best way to analyze it, I believe, is you go back to the Executive Order 11246 dealing with affirmative action in the workplace, and compare that to Title VII, the ADA, and the other discrimination laws. If you look at the Executive Order 11246, and you are a federal government contractor and you have the federal acquisition regulations and the like, you have certain requirements as a federal government contractor to do certain things under that executive order. It may be a written affirmative action plan. It may be certain data that you have to keep. It may be applicant logs. It may be this. If you then go over and you look at the statutory side, which is Title VII and the ADA, you don't have those same requirements. So if you look now at the executive order for federal contractors with the vaccine mandate, and then you look at OSHA, the same analysis, in my view, would apply. that if you're a federal government contractor, to do business with the government under the contracting authority that the federal government has, you must meet certain terms and conditions of doing business with the federal government, which is different than what OSHA requires. That's how I would analyze that. We have another question about a company has a mandatory vaccine policy. Employee has an adverse reaction to the vaccine requiring hospitalization. Is that going to be covered by workers' comp insurance, or how should it be handled? The answer to that question is this: you've got to look at your specific state statute on what's required for health issues and what coverage it might have. It would be premature of me to try to address any one of 50 states on whether or not it's going to be covered by comp. I'll try to follow up with that individually on an answer and get that out to you, because it's going to be really derivative from what your specific state comp statute requires. Question is there any indication when and if masks will no longer be required? There is none. A lot of that is being done on a more local level. By way of example, here in Columbia, South Carolina, our city council reinstituted the mask mandate back in August. They issued an emergency ordinance for 30 days. With the Delta variant still pretty heavy here in South Carolina and in the city of Columbia, they went ahead and extended it 60 days late in September. So we're looking at a mask mandate here in the city of Columbia based upon local ordinance for some period of time. Question about, is there too much money to offer or prizes offered to influence vaccinations? There's some guidance that has come out of the EEOC. The initial guidance was it needed to be a smaller amount. The most recent guidance said there was no cap on it. I think you just have to be smart as to what you're trying to do to incentivize vaccinations. A lot of it's going to be the size of your business, what you can afford, what you can't afford. Is there some number that will influence people to get vaccines or not? So a lot of that's going to be driven by those kinds of issues. Let's see. Yeah. All right. I think there's some other questions. I think I may have answered most of them. The key thing, I think, is when we look at this policy, we've seen the administration from day one come in. There's been a very detailed focus on COVID, on this pandemic, an effort to try to get folks back to work in a safe way. We are going to have this administration and this Department of Labor and its OSHA. And if you're under a state plan, you'll know that state plans have 30 days after issuances of standards or emergency temporary standard to fall into compliance with the feds. We're going to see enforcement there. When we look at the general duty clause, I think it's clear that this administration has focused in on that as the statutory vehicle from a health and safety standpoint in the workplace to try to address the pandemic that we've been through since March of 2020. What they're suggesting is, I believe, is to accumulate all of those things that you've been doing as an employer to try to protect your employees into a single document. And I don't know if you've ever been through any inspections. I'm sure some of you have been. But if I can hand any government agency a piece of paper or a policy and say, this is what we've done, how we've done it, and it's all in one place, you're going to be well ahead of the game in showing that you are working very, very hard to be compliant with all aspects of, in this instance, the OSHA law. And I'm not saying they're going to turn their head and put a blind eye to it, but if you can show that really good faith effort that you are putting forth to comply, you're going to be well ahead of the game when you have to deal with any issues that may come up under the standard side, specific standard side of an OSHA inspection. So this policy with the national emphasis program that's in place now because of COVID would be a very prudent thing for all employers to certainly consider, and would recommend that you do that. Let's see if we have any other questions. Question is, how will OSHA view companies that do not offer incentives? One, the guidance right now, does not require incentives. My view at this point in time is that that's a business call on your part. What they're looking for is whether or not you're doing the things to have a safe workplace. Are people masking? Do you have the distancing? Are you doing all the cleaning protocols? Do you have the PPE available? There's nothing that I've read that indicates that you have to offer an incentive. There's no legal mandate that you offer an incentive. That, I think, is a call that you would have to make as a business. Okay. Are there any other questions that I see up there? I think we've answered most of those questions. Wait, I see what I got. One more question that just popped up. Hang on. Let's see what that. Okay, all right, folks. That's what we have with regard to policy on a COVID-19 policy. I think you can see beginning in January through March through the August 13th guidance with the emergency temporary standards that are being issued, the national emphasis program. Again, it would be to each and every one employer's benefit to put that policy in place. If anyone has any questions about a template, we would hope that you would feel comfortable to reach out to us. We're working on those with a number of our existing clients right now to have in place if there was any inspection to be able to address this issue under the broad brush of that general duty clause. If there are no other questions, Shelley, I think that's about it. We certainly appreciate your joining us today to talk about this, I think, very, very important topic. I think it's very timely. And I think we're going to see, as we're all waiting with anticipation to see what OSHA does on the vaccine requirement here in the next a short period of time, I believe. And we'll be looking at that and getting out our guidance either through some alerts or the like as we move forward. Again, we appreciate everyone's interest joining us this morning. Hope everyone has a great rest of the day, wonderful weekend. And as I think we've all learned to come to say, everyone be safe and have a great day out there. Shelley,